Producer Ruth Brown sat down with Senator Julie Van Orden on Thursday to discuss a bill the governor signed with changes to Idaho's Medicaid program aimed at cost containment.
Thank you so much for joining me, Senator. The Medicaid Cost Containment Act, signed by Governor Little, was initially it was a bill that was a compromise from a bill that passed the House that would have repealed Medicaid expansion in its entirety. Walk me through some of the changes that came from this bill.
Compared to House Bill 138, this bill does not have a trigger to repeal Medicaid expansion. That was one of the big pieces in it. What we did end up putting in this bill that was also in House Bill 138 was a work requirement for able-bodied adults, which is the waiver that is in place with the federal government right now that we have applied for. It has not been approved yet, but it has not been denied. So it's still waiting there. And so that we felt like we could put in and be safe with what we're doing there. I know there was a lot of controversy around it, but there are a lot of carve-outs for people with disabilities, people who are taking care of their loved ones at home, people that are going to college or into a trade school. So there are a lot of carve-outs there. Another difference was in the House Bill 138, there was a limit on how many years somebody could be on Medicaid, and also there was a cap on how many people that we would take, which would be 50,000. Those were taken out, but there were a lot of things that were put into 345 that I feel were good pieces that protect citizens from some of the rising costs, hopefully, of health care in our state. And also we put in some pieces that helped our federally qualified healthcare clinics be able to sustain them, because they are our safety net for catching a lot of people out in our rural areas. So that was one of the pieces that I felt like were helpful for Idahoans.
So there's also, for those eligible for the expansion program, tax credits to buy insurance on Idaho's healthcare exchange.
Yes.
But some in the disability community are concerned that that tax credit would not be enough to pay for health insurance. What are your concerns around that?
I know the disability community has raised some concerns, and if you heard testimony in each of the committees, there was a lot of testimony and concern about that population. I've had conversations in the last little while with members of organizations that represent those individuals, and they have asked to be a continuing agenda item on our Medicaid review panel that we'll be meeting, and I asked them I said I would grant that to them if they would come to me with solutions. And so they have said that they would be willing to do that. So hopefully they will come with some of those solutions. That's what we want. We want a lot of input from the communities that are being affected by this. And I think we will get that when we're making decisions about what our managed care system will look like.
I'm going to go back to, we'll get to the managed care. It's a beast of a topic, but yes. I want to go back to the waivers for 1 minute. So a waiver requires the federal government's approval. As you well know, the waiver for a work requirement would require the federal government's approval. We have not gotten that yet. Idaho, I believe, applied for one even under the last Trump administration and was not granted it. What are your concerns around that? Are you hopeful that we will be granted a waiver?
Our waiver is still there. It's still in the queue. That's the one waiver from Idaho that is still in the queue at this point. So conversations that I've had with individuals that are probably close to this administration lead me to believe that there is coming, maybe from a federal level, a work requirement for able-bodied adults that are on Medicaid expansion programs within the states. I think that's coming with the new administration, and because so many states have tried for it and failed, that I think it's a popular, not a popular, but I think it's something that conservative states have looked at and wanted. And so with this administration, hopefully they'll be able to bring that from a federal level as a requirement. So that's what my gut is telling me is going to happen.
The biggest change, I think, that is the shift to managed care. Mm-hmm. Not everyone is on Medicaid. Can you walk me through a little bit about what does the shift to managed care mean for Idaho?
Okay. A lot of our services right now are what are called on fee-for-service. So the service is given and then we pay for that service. Through a managed care system, we have entities that will manage the care of individuals and help them make those decisions in consultation with them and what they think that in consultation with their doctors and with the individuals, what they feel like that they could need to help manage their care better for a better outcome on the other side. So it's a little bit different than just coming in and saying, you need this, we'll pay for this. It says, let's consult, see where your health is. It's more involved for the individuals and their providers and the managed care system to be able to look at how to address specific concerns of that individual and moving us towards, I think, a healthier population, because you manage their care as you go along. We all kind of manage our care, but there are individuals that aren't able to do that for themselves. So bringing in an entity that helps manage the care of those individuals, I think will hopefully put us on a trajectory towards more of a predictable amount that we're going to have to pay. And that's the biggest thing, I think, is we'll be able to predict better how much we're going to have to pay in those supplementals that come up in the JFAC process to address the needs of that population.
I want to touch on one more thing. Medicaid, for those that don't know, has a match. Part of the bill is paid by the federal government and part of the bill is paid by the state. There is concern that match rate could change. If so, can you walk me through what have you heard and what are your concerns around that?
So it's called an FMAP.
Yeah, it's confusing.
For regular Medicaid, it's the federal government pays 70% and we pay 30%. And for the expansion population, the federal government pays 90% and we pay 10%. On the regular Medicaid right now, our 70% has gone down a few percentage points, I believe, because as you do better as a state, and you have better growth in your state, so that you're doing better financially, mm-hmm. that the federal government drops that. So the better you do, the less you get, which in a way makes sense. A concern is that maybe we will be doing better, but and what would happen if that happened? In the interim, I can tell you, if something like that happened and we would have a different, have to pay a different amount, I don't know if our state, well, I do know what would happen like at Department of Health and Welfare. They would have to adjust what's going on there to make, in the interim, to make those payments, but, and then come back and have to ask the legislature for more money. But as a state, I'm concerned that things might change. But on a federal level, I think with our new administration, they're going to look at that and they're going to say, we've got to rethink this. And I think they're going to rethink Medicaid. I think that's part of the change that's going to be made with the new administration. Is they're going to look at the whole Medicaid program as a whole and hopefully look at that FMAP match and say, this doesn't make sense. So maybe we need to restructure this whole program in a way that does make sense.
If we're talking about restructuring Medicaid, you mentioned something earlier that I want to touch on, consumer protection. And this bill has some benefits to that in your opinion. Walk me through that.
Okay. One of the pieces that we did put in was called site neutral payments. And we had read an article, and they quoted Kathleen Sebelius, they used to be with HHS, and there were a number of bipartisan entities that said, this is something that the federal government needs to put in place to protect our citizens from the rising cost of health care. And what it does is, say a hospital system goes out and buys a small medical clinic, they are able to charge their higher rates, the hospital rates at that system. This bill would not allow them to be able to do that. So they would still have to keep the rates that were at that medical center so that there again, the consumer doesn't have to pay those higher prices. That was one of the big parts that I felt like needed to be in there. For me, that was a game changer. And I felt like it was something that Idaho could do. They were talking about doing it, in the article at a federal level, that they needed to do it at a federal level. I don't know if that would ever happen. And if it did, great. But it was something that I felt like we needed to grab onto at a local level and a state level and put it in place.
Senator Van Orden, thank you for your time.
Thank you.